My name is Anita Benefor, and I am one of the placement students for A Safer Space. This presentation is going to be on what autism looks like for somebody who is high functioning. What does high functioning autism mean? High functioning autism, previously known as Asperger's disorder or Asperger's, which was changed in 2013 in the DSM, falls under an umbrella diagnosis of autism. Typically, individuals in this end of the spectrum have strong language skills and can function pretty well within society. They have high intellectual ability. Some examples of this are they can keep a job, they attend school or university or college, they can maintain good personal hygiene and can dress themselves with little to no support, and they can live on their own and make food for themselves. Also, high-functioning autism generally involves a difficulty with social interactions, restricted interest, desire for sameness, and distinct strengths. So those are some of their weaknesses or, I guess, challenges. Social interaction and communication. The main difficulty they face is with social interaction and communication. Why, you may ask? They lack the ability to read social cues. They typically struggle with making eye contact with other people, and they have an inability or a lack of interest in perspective taking, meaning that it's hard for them to empathize with other people. They are often labeled as weird, odd, strange, quirky, nerdy, geeky, or awkward. Social cue difficulties. So they have a difficulty on not understanding personal boundaries, not giving other people adequate space while they're in their presence, standing too close while talking to others, or speaking too loudly in public, or overtaking or centering conversations around their own personal interests or themselves. They lack what I guess normal people would know as social pragmatics. So if it's not something pertaining to what they like, they're not interested in knowing about it, or if it's about your interests, they could care less. And that's not something they do on purpose. It's the way that their brain is wired. Difficulty with socially acceptable conversational cues and body language. So people who have high-functioning autism typically have little to no eye contact when they are talking to you, have a difficult time engaging in small talk while speaking to others. They lack the ability to carry socially acceptable conversation skills. Asking questions like, how are you and how's your day going, are things that must be taught. Teaching high-functioning autism individuals appropriate social skills is essential in them recognizing how to navigate effectively in social settings. So with my experience with clients who do have this form of autism, I've noticed that, again, they typically center conversations around their interests. One client that I could think of really well, she typically loves anything to do with cars or the TTC or airplanes. So whenever she does see somebody, she will ask, what highway did you take to get to work? Or what's your favorite airline? Where have you traveled to? What bus have you taken before? Do you know the routes here? Or she'll ask, can you take me to the subway station by Union? Or she'll have long conversations about different subway lines and old ones, or she'll ask if we can print out pictures of old subway cars, subway buses, trains. So a lot of the work and the programming that we've created at my workplace has been centered around how to communicate with others while you're in their presence. Or so, like, because she likes to ask a lot of questions about these things or about her interests, we'll give her like maybe 3 to 5 questions she can ask within a certain time frame. After she's asked those questions, she needs to move on to a different task or to do something that's socially appropriate. So we're not necessarily eliminating her interests or the things that she likes to discuss, but we are just trying to teach her a way to function with other people who don't have her diagnosis so that it's easier for her to navigate. Some other behaviors individuals with high functioning autism display are obsessions with routines and structure, engaging in repetitive behaviors, which can serve as a coping mechanism or a calming mechanism, or just something that they have intense interest in. When they are interested in a topic, they tend to study it at extreme lengths, like an expert would, which can be seen as a strength and not necessarily a negative thing in all scenarios, and will talk about it excessively until they move on to something else. They will correct anyone that makes a mistake about said topics and are usually about 90% right most of the time. So another client that I have worked with, he is like the perfect example of this. If, he knows a lot about cell phones, so he will ask you what model your phone is, what's your battery life on the phone. He will tell you facts about the phone that you yourself don't even know. And when I Google the facts, they're usually always right, which is so crazy to me because I don't understand how they have the brain capacity to even memorize certain things. Like, they have very good memory. If I tell him something on a Monday and my next shift is the following Monday, he will tell me verbatim what I said to him. And I won't even remember sometimes, but that's just how good their memory is. And so, like, sometimes with the work schedule, he will memorize who's coming in, but he will ask, oh, is so-and-so working today? And I will say, I'm not sure. You tell me. And he will tell me verbatim who is on the schedule just because he has great memory. So something else that individuals with high-functioning autism deal with is sensory overload. They may function well in small, confined social settings like a classroom, but may break down in larger group settings like a mall or a concert. Why, you may ask? It is outside of their regular routine structure, which then triggers sensory levels to go into overdrive. This then results in a heightened feeling of panic, discomfort, or uneasiness. This can be displayed as them showing attitude, being rude, or having a full-on mental breakdown in a public setting. In these moments, mentally, they're feeling trapped and are willing to do anything to feel safe again. It's almost like a flight or fright mode. They don't mean to be rude. They don't mean to come off that way, but they're feeling scared. They're feeling uneasy. So if that means being aggressive, if that means being verbally aggressive to get out of that environment and feel safe, then that's what they will do. Some misconceptions about people who have high-functioning autism are typically that they don't fit in within normal social norms and are often stigmatized and labeled as rude, awkward, or weird. They are perceived to have a lack of empathy. This one I found very interesting. Individuals with high-functioning autism aren't sensitive, or that they don't feel for others. And when I was doing my research on this, I was actually reading the comments under the video, and a lot of people who have high-functioning autism left comments saying that it's actually the opposite. They actually do feel so much for people that it's distracting and it's very difficult for them to function. So they have to suppress those feelings, and in them suppressing the feelings, it comes off like they're rude or that they're awkward or that they don't feel for others, when really they actually sometimes feel just as much or even more as the person going through something. Distinctions need to be made that they simply just have difficulty expressing or putting themselves in other people's shoes, but nonetheless, they can still feel the pain or discomfort that others feel. They may not be able to adequately express these thoughts or concerns. However, they most certainly would do anything to try to relieve others of their pain. One of the comments that I saw under this video was a man saying that he typically has very good relationships with animals because he feels their pain, or he has an emotional connection to them. I guess because with animals, you don't have to communicate with them verbally. They feel things. So he has a very strong bond with animals, which I found very, very interesting, and kind of how this kind of correlates to one another. Mirror neurons and imitating behaviors with people who have high functioning autism. Mirror neurons are based in the front of our brains, the prefrontal cortex, which help us recognize and imitate or pick up behaviors in others that we could see and relate to on a personal level. So people with high functioning autism have fewer mirror neurons than those who don't have ASD. So in short, this just means that this perceived lack of empathy that they have for others is not necessarily true. It's not by choice. It's that way because of how their brain is wired. So it might appear that they can't feel for somebody, or they don't know how to express how they're feeling for other people when they're going through something, when really it's just because they don't have the luxury of having as many mirror neurons as somebody else who does not have autism. Some therapies and services for people who are high functioning are as followed. Cognitive behavioral therapy, which can help address anxiety and other personal challenges. Social skills and training classes, which can help conversational skills and understanding social cues. Speech therapy, which can help with voice control, because sometimes they feel nervous, sometimes they get antsy, sometimes they don't respond when people are talking to them. So that will really help with their overall voice control and conversation. Physical and occupational therapy can actually improve coordination. Psychoactive medicines can help manage associated anxiety, depression, and attention deficit and hyperactivity disorder. That's the end of my presentation. Thank you for listening.